There may be a continuous source of inflammation pouring into your bloodstream right now, and it's not in your back, your joints, or your nerves. It's in your mouth. Chronic gum disease can feed a low-grade, body-wide inflammatory fire that quietly amplifies pain everywhere else. And almost no pain workup ever looks for it. Let me show you the connection. I'm Dr. Padda. We're continuing our exploration of the hidden drivers of chronic pain, and this one surprises almost everyone: the health of your mouth. The community of bacteria living in your mouth, your oral microbiome, has a direct line into your bloodstream. When it goes wrong, the consequences reach far beyond your teeth. Here's the setup. Periodontal disease, chronic inflammation, and infection of the gums is extraordinarily common, and many people have it to some degree without knowing. The gums, when inflamed, are not a sealed barrier. They become a raw, open, inflamed surface sitting right on top of a rich blood supply. That makes the mouth a continuous immune stressor, a place where the line between a bacterial colony and your bloodstream has broken down. And unlike an acute infection that flares and resolves, this one simmers day after day, year after year. Now, the mechanism. When the gums are diseased, oral bacteria and the inflammatory molecules they provoke enter the bloodstream directly. Something researchers can actually measure after everyday activities like chewing and brushing in someone with periodontal disease. So you have bacteria and inflammatory cytokines being seeded into your circulation on a regular basis. Your immune system responds to each of these incursions, maintaining a perpetual state of systemic low-grade inflammation. And by now, you know the refrain of this entire series. Systemic inflammation sensitizes your nervous system. It lowers your pain threshold throughout your body. Your sore gums may be turning up the volume on your back, your knees, everything. This isn't a fringe idea. Medicine has increasingly recognized that periodontal disease is associated with conditions far from the mouth: cardiovascular disease, diabetes, and other inflammatory conditions. The common thread is exactly this systemic inflammatory burden. The mouth is a window into and a contributor to the inflammatory state of the whole body. So when I'm trying to understand why a patient's pain won't settle despite doing everything else right, an unaddressed, chronically inflamed mouth is one of those overlooked sources that can keep the whole system lit up. The evidence linking oral health to systemic inflammation is well established. We can measure bacteria entering the blood from diseased gums. We have strong associations between periodontal disease and systemic inflammatory conditions like heart disease and diabetes. And we understand that the inflammatory cytokines generated in the mouth circulate body-wide. For a person in chronic pain, this is a genuinely actionable and genuinely overlooked piece of the puzzle. So if you've been to specialist after specialist for your pain and not one of them asked about your gums, and your dentist, meanwhile, was never told about your chronic pain, you've experienced the great flaw of fragmented medicine. Your body is one connected system, but it's treated by separate professionals who rarely talk to each other. The connection between your mouth and your pain fell straight into that gap. That's not your fault, and recognizing it opens a door no one else thought to open. So here's what we do. We take a whole body view, and that includes recognizing the oral microbiome as a potential driver of systemic inflammation. We'll help you understand the connection and make sure your oral health is being properly addressed in coordination with your overall care, rather than walled off as someone else's department. As that chronic source of inflammation is brought under control, the systemic inflammatory burden drops, and your sensitized nervous system gets a chance to settle. Combined with the metabolic and regenerative work we do, removing a hidden inflammatory source like this can be the difference between pain that lingers and pain that finally resolves. Sometimes the fire feeding your pain is burning somewhere you'd never think to look. We look at the whole system because that's where the answers hide. If your pain has defied every local explanation, let's widen the lens. Go to painmd.tv and take the first step. I'm Dr. Padda. Your whole body matters, and we treat it that way.